Hello, everyone. I am Precious Soriano, and today we will be discussing about one of the most common food and waterborne diseases, which is typhoid fever. Come on, join us as we delve deeper into this topic. In this presentation, we will define typhoid fever. We will look into its pathophysiology, how this disease is diagnosed, enumerate the recommended treatments, and discuss the nursing care for this illness. Quick trivia. Did you know that the origin of typhoid fever was started by an Irish-American cook named Mary Malyon, who was later known as Typhoid Mary? Doctors theorize that Malyon passed the typhoid bacteria by failing to properly wash her hands before handling food. What is typhoid fever? Typhoid fever, also known as enteric fever, is a multisystemic illness that has been a public health issue, especially in developing countries. The main cause of this illness is the Salmonella typhi bacteria. Mode of transmission. The bacteria is transmitted through fecal-oral route. Salmonella typhi is transmitted by the fecal-oral route through contaminated food and water, undercooked foods, vomites of infected patients, and is more common in areas with overcrowding and poor sanitation. The incubation period depends on the inoculum size and on the host factors. It typically ranges from 1 to 3 weeks with an average of 18 to 14 days. The most common signs and symptoms of typhoid fever are high fever, raw spots on the chest, weakness, headache, loss of appetite, constipation or diarrhea, and generalized body ache.
Hello everyone, I'm Marian Ferry and today I'm going to discuss diagnostic procedures and treatment. For the diagnostic procedures, diagnosis is made by any blood, bone marrow, or stool cultures with Widal tests. Our first diagnostic test is the Widal test, which is an agglutination test, which detects the presence of serum agglutinins H and O in patient serum with typhoid fever. Yields culture result in 2 to 7 days. One is the typhoid test, and it is done on a .ELISA kit that detects immunoglobulin M and immunoglobulin G antibodies against the outer membrane protein or OMP of the Salmonella typhi. The typhoid test is expected to become positive within 2 to 3 days of infection, and the test is based on the presence of specific immunoglobulin M and immunoglobulin G antibody. For the treatment is the antipyretic for fever and analgesic for pain. This is also the recommended antibiotics for uncomplicated typhoid fever, which includes amoxicillin, chloramphenicol, TMP-SMX, cefixime, citromycin, ciprofloxacin, and ofloxacin.
Corticosteroids or prednisone may decrease the likelihood of mortality in severe typhoid fever cases.
Hi, I'm Maria Suset Karampatan and I will be discussing about nursing care and preventive measures of typhoid fever. Provide assistance for ADLs. This provides assistance to meet their daily needs, involve the family in the fulfillment of ADL, and explain the purpose of bed rest to prevent complications and speed up the healing process. Encourage increase in fluid intake. Monitor the status of hydration as needed. Monitor the fluid intake daily. Encourage and increase fluid intake and collaborate with other medical team for IV fluid administration. Improve nutrition intake. Monitor the amount of caloric intake, monitor weight loss, provide a comfortable environment during meals, and encourage an increase in protein and vitamin C intake to meet nutritional needs. For the preventive measures, first, practice proper hand washing. Second, proper food handling. Third, treatment of community water. Fourth, proper feces disposal. And fifth, health education and proper hygiene. Well, that's all for today, and thanks for watching.